Hi, amazing nurses of the world. My name is Sara Rose Tamir, and I work with Avant Healthcare Professionals. Avant is a company that hires and helps nurses from all over the world that have a goal of living and working in the U.S. as a registered nurse. If hired by Avant, we provide support and cover the costs financially for so many things to help you get to the U.S. and achieve your dream. We receive thousands and thousands of applications every single year, and unfortunately, we can't hire every single person. The nurses that have the highest likelihood of successfully joining our program are those that apply with clear and accurate information on their resume and application. So I'm here today to talk with you about what that would look like, so that way you have the highest chance of being successful and joining our program, and you can apply with confidence whenever you're ready. So let's get started. So first thing, when you're ready to apply, you're going to go to our website. That's AvantHealthcare.com. Avant is spelled A-V-A-N-T, and then you have healthcare after that, .com. Once you're on the website, it's going to look a little something like this, and you're going to click on Apply Now. This is our main application page. Now, for the sake of this, I'm going to use some real information about me, but I'm also going to use some fake information about me. When you apply, please don't do that. We need all accurate and real information about you when you're applying. So let's just get started. So first name, I'm going to say Sara Rose, which is true, and my last name, Tamir, T-A-M-I-R. Now, although I have some pretty cute nicknames, I am going to go with my official legal name just as it would appear on my passport. So we want you to do the same thing. Then I need to enter an email address. So I will go ahead and enter that. I want to make sure I'm picking an email address that I have access to regularly, and then I want to make sure I'm checking it regularly, because when you apply with Avant, we're going to be in communication with you by email a lot, so it's important that you have access and can check it frequently. Then it's time to provide a phone number, so that way if we need to reach you for an interview or an update on your application, we can get in touch with you. So go ahead and enter your phone number. If you'd like, you can enter the country code as well. That is helpful for us. So I'm in the US, so my country code would be 1, and then I'll just enter my full telephone number. Then it's time to select where I was born. So for me, that is the United States. And keep in mind, this is where you were born, not where you are currently. So please make sure you are selecting where you were born for country of birth. Then date of birth. Let's see, so I was born in August. We'll go ahead and choose that on the calendar, and it was the 13th. Now, as you might notice, it automatically selected the year 2023. I certainly was not born August 13th, 2023, so you want to pay, of course, close attention to detail when filling out the application and make sure that you are submitting clear and accurate information. So we can change this pretty easily. Let's see, we're just going to go to the year, and we'll pick a year. 1989, August. It wants me to pick the day again. A little strange, but that's fine. We can get through this. So now I'm going to double check and make sure what I have here is correct. August 13th, 1989. That is totally my birthday, so I'm good to move on to the next piece. Education. Okay. What initial educational program did you complete for your profession? So was it a certificate level program? Was it a bachelor's level program? Keep in mind, we are asking about your initial education. So even if you went back to school and did a bachelor's program, a master's program, we want to know what was your very first type of program that you completed to become, whether it's a registered nurse or a physical therapist, whatever it might be. So in this instance, unfortunately, I'm pretending to be a nurse. I'm not actually a nurse. Wish I was, but we'll pretend that I did my bachelor's in nursing as my very first education for becoming a registered nurse. So I'm going to select bachelor's degree. What country did I complete my initial nursing education in? We'll say United States. All right. And what was the name of my college or university where I completed my initial nursing education? We're going to go with University of Central Florida. That part is true. I did go there, but not to become a nurse. And then when did I graduate? It's going to give you the calendar. It's going to want you to enter specific information. If you don't know the exact day, that's okay. Even if you're not sure of the exact month in the year, it's okay. Give us your best estimate as to when you think you graduated. So according to my resume, I graduated in March 2020. So I'm going to select that, March 2020, and I'll just pick a day, let's say maybe the 9th. And then I'm going to double check and make sure that the date that the computer registered in this application is actually what I intended for it to register. So it does say March 9th, 2020. We are good to move ahead. Let's keep going. Work experience. Are you currently working? This is so important because when we review your application and consider you for our program, we have to take into consideration your work experience so we know what kind of job opportunities we can have for you with our clients here in the US. So it's going to ask if you are currently working. If not, select no, please, and then answer the following questions. But in this instance, let's say we are working. I'm going to say yes. It's going to want to, or it is going to ask me how many total years I've been working in this profession. So I'm going to say between 1 to 3 years. Then it's going to ask what type of clinical setting I work in. You know, there's so many settings that we have nurses from all over the world applying in. We see them in home health, we see them in nursing or care homes, in hospitals, as educators in universities. So pick the one that is most closely aligned with where you are currently working. Not where you've worked in the past, but where you are currently working. So we will say hospital. I'm working in a hospital setting at this time. Then it's going to ask the name of the facility you're working in. Facility just means where you are currently employed. That is a word that we've seen some people question, like, what do you mean by facility? It's wherever you're currently employed. So I'm going to say I'm working at Avant Medical Center Hospital. Oops. There we go. All right, that is where I'm currently employed. And then it's asking how many beds are there total in the hospital that you work in currently. Now, please pay attention. This is asking for your whole entire facility, not just the unit you work in. So I'm going to go ahead and say over 300 beds. It's a big hospital. And then it's going to ask what unit, specialty, or ward I'm currently in. So in that hospital, what unit are you assigned to? And keep in mind, it is asking about where you are right now. Even if you have like 20 years of experience in another unit, but you just moved to a new unit, we want to know where you just moved and where you are currently. So in this instance, I will say I am in the intensive care unit. All right. Now we want to know how many beds are in the actual unit that you work in. So we'll say 25. 25 beds are in the ICU that I work in. Then it's going to ask when you started working at your current facility. And keep in mind, this is your current facility, not your unit. So I started working there, let's say in June 2020. So I'm going to select June, I'm going to select 2020, and then I'll pick the day. Let's say it was the 15th, and then I'm going to double check the date on the screen and make sure that it entered correctly. June 15th, 2020. Looks good to me. Let's keep moving. What is the title of your current position? So when we ask that, let's say you're a registered nurse. We want to know that you're a registered nurse, but that's not what we're referring to in this particular question. We want to know what your designation is, your official title. Are you a charge nurse? Are you a staff nurse? Are you a senior staff nurse? Are you a junior nurse? What do they call you? On your offer letter, what kind of position does it state that you have at this hospital currently? So in my example, I am a senior staff nurse. So that's what I'll enter on my application. Then it's going to ask what type of facility you work in currently. And this can be a little confusing to some people, so I want to explain. When we ask this question, we mean what level hospital you're currently working in or what level facility you're working in. So if you're in a community health clinic that's in a rural setting, that could be like primary care in terms of the services that are offered. So that would be primary. primary doesn't necessarily mean main or big. It's primary care services that are offered at that facility. So an example of that could be like a primary care doctor, your family physician, or a community health center, something along those lines. Secondary could be a hospital that offers basic services like medical, surgical, maybe emergency room or maternity. Services are offered, but not covering all the specialties necessarily. Whereas a tertiary hospital, those oftentimes are teaching hospitals or level 3, level 4 hospitals. A variety of services are offered. They're generally a bit bigger. So that's what we're referring to with that question. So I'll say tertiary for my current facility. Then it wants to know if I'm a registered nurse, physical therapist, or occupational therapist. Those are the only 3 professions that Avant can consider for our program right now. So if you're not one of those, unfortunately, we wouldn't be able to consider you. But if you are one of those, please select what your profession is. I'm going to say registered nurse. Then it's asking if we've taken and passed the CGFNS certificate program. So if you are a CGFNS holder, select yes. If not, select no. I'll say no to that. And then it's asking if I've done any postgraduate qualifications. So if I went back to school and did an ICU specialization for a year, or maybe did an emergency room course or anything like that. So I won't select anything in this instance. I'll just say no. But if you've done something after you completed your initial nursing educational program, then you want to let us know what that is by selecting one of these. Up next, it's asking about the NCLEX. The NCLEX is the U.S. Registered Nurse Licensure Exam. So nurses that were educated in the U.S. need to take and pass the NCLEX before they can practice. And anyone that wants to come to the U.S. and practice here needs to take and pass the NCLEX. So it's asking if I've taken the NCLEX. I'm going to say yes. It's going to ask if I've passed or failed that NCLEX. I'm going to say passed. Then it's going to want to know which board or state you passed the NCLEX through. We'll go with Florida. Then it's asking if I've taken an English proficiency exam, such as the academic IELTS, the general IELTS, the TOEFL IBT, OET, PT. There's so many different English proficiency exams now. We want to know if you've taken any of them. Yes or no. Even if it was years ago, we are curious and we would like to know. So I'll just say no in this instance. Then it's asking if I have a valid visa screen certificate. A visa screen is issued by CGFNS, and it is different than the CGFNS certificate exam that was asked about previously on the application. So in this instance, I will just say no. Next, it's asking if I have a previously filed employment-based green card petition. So if you've applied with another U.S. agency and they filed for your green card, then you likely have a previously filed employment-based green card petition. If not, then you do not. So I'm going to say no. I've never worked with another agency and they've never filed a green card petition for me. And next, it wants to know what country I currently live in. So before it asked where I was born, now it wants to know where I am currently. And I'm still going to be in the United States in this instance, so we'll go with that. Now, we see here it's asking for our resume and our CV. This is so important, and we're going to go over what a great resume and CV could look like, but you want to make sure you have a file ready to upload with your application. And then once you're ready, you'll click here. But first, before we actually upload that file, let's take a peek at an example resume that I've put together. So, here we are, Sara Rose Tamir, registered nurse in my dreams. But for today, I get to be a registered nurse for this example. So my first name and my last name are identical to what I've put on the application, and that's identical to what is on my passport and any legal documents of mine. And that's important because when you go through the immigration process and the licensure process, Avant's going to help you every step of the way, but we need to make sure your name is as it appears legally and is consistent. That way we can get you through that process without hiccups. So you want to make sure your name is clearly on your resume. I'm a registered nurse, so I'll just throw that in there. You don't need to put a picture, but we would love to see your beautiful face if you'd like to. And then some basic contact information like a phone number, email address. If you'd like to put your address, you can, but really we want to make sure that we have your phone and email address that are accurate so we can get in contact with you. You do want to outline your education. So for me, I just completed a Bachelor's of Science in Nursing at UCF. I have the name of the nursing program I completed. I have the date I started that program and the date I finished that program. I also have the name of the school that I completed the program in and where that school is located. Education is huge in terms of qualifying for the Avant program. We need to know that you are a registered nurse or the type of profession you're sharing with us. We need all the details about your education. So please make sure to be comprehensive when including information about your education on your application with Avant and on your resume. Nursing eligibility, what licenses do I have to practice nursing? As an example, if you were born in the Philippines and you were educated as a nurse in the Philippines and worked there for a few years, and then you moved to Qatar and worked as a nurse in Qatar for a few years, and you hold licenses in both, but maybe now you're back in the Philippines, we want to know, where have you held a nursing license? Because that's going to be important for the process later on when getting ready to come to the U.S. So if you've worked as a nurse in multiple countries, please make sure to list the different types of licenses that you've held. So for me, we'll just say I'm an NCLEX passer and I have a Florida nursing license. So I'll put my license number and I'll put when my license is valid until. Now, moving on to the juicy stuff, your work experience. You want to make sure that you are covering start to finish all the different work history that you have as a registered nurse or a physical therapist, whatever it might be. In this example, again, just a registered nurse, so we'll focus on that. So you want to cover every employment that you've held, and for each employment type, you want to have a start date and an end date, so we know how long you were there. So we are going to start with what I'm doing currently. I began there in June 2020. If you know the actual day, throw that in there as well, maybe June 7th, 2020. And then, is there an end date or are you there currently? If you're there currently, you can use the word present, current, actual, just something to let us know that that's where you are still currently working. So let's say June 2020 to present, I've been employed at the Avant Medical Center Hospital. So I'm going to put the full name of my employer or my facility, and then I'm going to list the address. And it's helpful to provide a short description of that facility. So we'll say this is a 444-bed, tertiary level, privately owned hospital. The facility opened in 2004 and offers the following services: medical ward, surgical ward, maternity ward, operating room, ICU, CCU, HDU, emergency, and OPD. You don't have to list every single thing, but try and paint a picture for us. Where you work as a registered nurse, what services are offered there? Is it government owned? Is it privately owned? How many beds does the whole facility have? We need to understand as much as we can about your current facility. Then we need to understand the different units that you've worked in and the different titles, positions, or designations that you've held while at that facility. And clear and obvious start date and end dates for each are crucial for us. So an example. Let's take it from the very beginning. We like to do things in chronological order. I started there in June 2020, and I want to list what my title was when I began and what unit I was in when I began. So let's say I was a staff nurse in the medical surgical unit. I started in June 2020. I had a change in July 2021, so that'll be the end date for that little piece of my experience at the hospital. So let's say in August 2021, I started working still as a staff nurse, but I left medical surgical and began in ICU. I want to make that clear. So this is an example of how you can do that. And then let's say I am still in the ICU, but my position changed. I got a promotion. Yes, I am now a senior staff nurse in the ICU as of September 2022 to present. So as you can see, these three changes all occurred within the same facility, but there were changes in terms of the unit I worked in, the role that I held, so I'm clearly outlining what those changes were in chronological order so we can see and appreciate the timeline of things. Now, if you've worked at different facilities, we want a start date, an end date, the name of the facility, and a description of the facility. And if you can give a breakdown of the things you've done there, great. But our main and primary focus is on what you are doing currently. Wherever you're currently employed, we do need a very thorough breakdown of your history there. If you'd like to list, a short description of your job, your main responsibilities at work, maybe some of the common cases that you handle in your ICU or your ER or whatever unit you work in, that really helps us understand and appreciate your unique clinical experience. If you're working in an ICU, maybe tell us about the different kinds of medical equipment that you commonly work with. Maybe nursing skills you're commonly utilizing or performing at work. The more information you can share with us about what you see and do as a nurse every day is extremely, extremely helpful. And if you'd like to list some additional training or qualifications, anything like that, you're more than welcome to do that on your resume as well. But then let's say we've got the resume, we're ready, we've filled out most of the application. Now it's time to upload that resume. We're going to click on Choose File. And we will go to upload that file. That's the next step. Here we go. So as I can see, my file is selected here. I'll just double check, make sure that's the exact file I want uploaded. You'd be surprised. Sometimes we get some strange things in place of resumes. Instead of looking for, we'll go expecting to find out information about your hospital, your unit, your role, your education, all these great things we're super eager to learn more about. And we'll find a picture of a shoe, something random, which maybe if you don't have something to upload, you just want to put some file so you can submit the application. I understand, but ideally you're submitting an actual CV or resume that has helpful information about your education, about your work history, a little bit about your contact information. That's what we're looking for when we look at your resume. Up next, it wants to know how you heard about Avant. So some examples, maybe I was scrolling on Facebook and an ad popped up and I was like, heck yes, I want to apply with Avant and be that nurse in this picture. Then we just want to know it was Facebook. But a lot of people apply to the Avant program because they've heard about it from a friend, a classmate, a coworker. So if that's the case, please be sure to list their information because Avant does have an amazing referral program. And if you are hired as a registered nurse and successfully make it to the US with Avant, we want to give whoever told you about us credit for that. And we'll offer them a bonus. So let's just say I was referred to Avant from my friend. I will say it was a friend, and I'll say their name. Let's say Ashley Jones. There we go. Next, I am going to include the email address of Ashley, so that way Avant can contact Ashley and give her her referral bonus when that time comes. We'll say ajaj@yahoo.com. That was a bit of a funky email, but that's okay. This is just pretend. But when you're submitting this, make sure it's not pretend because we do want to give your friend credit, and I'm sure you want to give your friend credit too. Then it's just asking me to confirm that I have read and understand the EEO and privacy statements, which are listed above here if you'd like to read through those. Let's say I have, and then it's asking me to type my name in place of an actual signature to verify that all the information I'm providing on this form is true and correct. So it is. Now, actually, it's not because this is an example. I'm not actually a registered nurse, and we don't want you to do that, as I mentioned, but when you're doing this, it should be accurate. Your education, your work history. Don't tell us you've passed the NCLEX. If you haven't passed the NCLEX, it's okay. We have an NCLEX review. We can help you pass the NCLEX if you're qualified. But again, so important to just be authentic and transparent and honest with the information you share with us. So then we will go ahead and click Submit. It gave me an error. Please complete all required fields. What have I possibly missed? So, have you completed any additional postgraduate qualifications? It says, please select at least one option. That was my mistake. I was not paying attention to detail. There is an option NA. So, if you have not taken any postgraduate qualifications, select NA. Should be in the clear now. Let's try to submit again. Boom! we're done. It says, congratulations, you've just taken the first step toward achieving your American dream in the USA with Avant Healthcare Professionals. Got a little message here, and it's got some more information on the referral program that I spoke to earlier. So, are you curious what happens next? I will tell you. So you've submitted this application, you've got a great resume attached. Our recruitment team is on standby, ready to receive applications and review them. So when they receive your application, they are going to look through everything very closely. And they're going to start researching your hospital, your unit, looking up the school you attended potentially. They're going to review everything to see if you meet the criteria to move ahead and be considered for our program. Either way, whether you're qualified or you're not qualified, our team is always going to get in touch with you to provide an update by email. Now, let's stay positive. Good news, hopefully you do qualify. Then you're going to be moved ahead to begin the hiring process with our team. So please be sure to check your email after you apply so you can receive the update. And if there's next steps for you because you've been moved ahead, those will likely be completing 2 screening exams and watching a program video. That way we get an idea of your baseline clinical knowledge and English knowledge, and then you get some insight as to what our program is like and what the expectations would be of you if joining our program. And then once those things are done, if you have passed the screening exams, then you will be scheduled for an interview with our recruiter who's going to talk to you about all things Avant, answer all of your questions, and then potentially be scheduled for a second interview, which is focused on understanding your clinical experience. And at the end of that, we look to see, can we make you an offer? And if so, we send you the contract. You have some time to review and ask questions. And then once you sign the contract, that is when you are officially an Avant nurse and the process for you would begin with our team. So that is the basic rundown of filling out the application on our website, which is avanthealthcare.com, preparing and submitting a resume, and really just paying attention to detail, making sure that the information that is on your resume is consistent with what's on your application and that it's accurate and honest information. And then, of course, if you have questions after you've applied, email us. You'll receive communication by email from us. Email us back if you're having a hard time with anything. Our team is here to support you. So now you know the basics. If you have questions, even right now, if you watch this video and something's still unclear, or there's something on your mind or something on your heart you want to know more about, our team is always here to help. You can leave a comment on this video wherever you're watching it. You can send Avant a message on Facebook. We are on standby to support you as you begin your process, either considering to work with Avant or applying with Avant. We're always here and more than happy to help. So if you are ready, feel free to visit the website. Now you know what to do, what to expect, and we're really excited about the opportunity to work with you and wish you the very best. Thank you for watching this video. We hope to see and talk with you soon. Bye!